Welcome, everyone. I am Dr. David Pascal, chiropractor in Cary, North Carolina. I am the owner and practitioner of the Pascal Health Institute. Today is January 8th, 2025, and yesterday marked the beginning of my 38th year treating patients. And I'm very excited about that, excited for the future, for myself, for my friends, family, staff, and most of all, for all of my patients and potential patients. So let's get started. Today, we are going to talk about what are the questions that every CRPS patient or the support person of a CRPS patient should ask a doctor before starting care or before even going to their clinic. The things that you should know about a doctor and their approach and success rate and all of that before you even show up in their office. And of course, this is my opinion. I'm going to cover a bunch of potential questions, and I'm sure there are an infinite number, but hopefully we will cover the major ones that we should all be asking up front. So first, I think it's totally reasonable to ask the doctor why are they motivated to treat patients with CRPS? Why do they want to help patients that have complex regional pain syndrome? Very important motivating factor, I believe. Second is, what do they think is the reason or are the reasons that cause CRPS? Like, why does one person sprain their ankle and they have CRPS and someone else sprains their ankle, most people, and they don't get CRPS? So what's up with that? Next would be a question along the lines of how long they've been treating patients with complex regional pain syndrome, roughly how many patients they believe they've seen over the years, what their success rate is treating CRPS, and how do they define success? How do they, some people say, hey, if we can take your pain from 20 on a 1 to 10 chart down to a 10, we've cut your pain in half, and that's phenomenal, right? They might feel that's how they chart it. Or, hey, you have to have no symptoms at all for 3 months until we call that a success or in remission. So that's important to know. How do they label success? How do they chart success? How additionally, what does the term remission mean to them? Do they think a person can get into remission? Does remission include ongoing care? Like, okay, you're in remission, but you have to do 4 hours of care at home every day to stay that way, or you have to take this list of drugs, or you have, these surgical procedures that have occurred. I made a list, so I'm going to cheat a little bit, so bear with me. What is your training? What makes you qualified to treat a CRPS patient? What is your approach? Are you doing hands-on work, or is this all with some type of technology like lasers and magnetic fields? Is this a drug-based approach, a nutrition-based? Like, what are the things that you as the patient are receiving, and who's delivering that care? Are you the doctor seeing me? And if you are, how long is that visit? What are you doing as a doctor during that visit? Are there other staff in your office that are going to be doing some type of care? What does that look like? How often am I coming? How long is a visit? How long am I going to be in your office? How does your office run? If I have a 10 o'clock appointment, am I seeing you at 10 o'clock, or am I seeing you at 10:40 because I'm sitting in your lobby because you run slow every day? Am I seeing you multiple times in a week? Am I seeing you multiple times in a day? How long is your overall treatment program? I'm just going to go through these very quickly. You can if I go too fast, since this is recorded, you can always back up and watch again, right? Um, when you come up with a treatment program, what are the things that went into that decision making process, and how often are you charting progress? What do you do if I, as the patient, am not meeting your expectations in terms of progress? Are you reevaluating? Are you modifying? Or do you believe, okay, this is our program, we have faith in our program, and regardless of your day-to-day progress, we know that eventually you're going to get there, through the time frame that we discussed. These are all very important questions to ask. Um, Also, what can you as the patient expect to pay out of pocket? Does insurance cover anything? What is the expected insurance coverage for that care? What's the expected cash outlay for that care? Are there any other associated expenses, like am I going to need to buy supplements or medications, or pay for surgery that's an add-on to your care, or other things like physical therapy or mental emotional type care, and what is my expected out of pocket for all of that. These are all important things that you should know. And then the last thing right now that I can think of, maybe I just address this, is how often am I coming, and for how long. As I mentioned before, there's a giant list of potential questions. If you have some more suggestions, you can post them underneath this video. We'd love to have them. If you have any questions about the suggestions that I came up with, please feel free to reach out. You can post below this video. You can send us emails. You can send us um, text messages, or you can call our office as well. Since this is live, I'm going to ask Danielle if we have anyone with a question. All right. We don't have anyone with a question. I will ask Danielle one more. Uh, is there anything else that I should have said that I didn't cover? I know I zipped through a whole bunch of things.
No, I think
All right, great. So those are all very important questions. I believe next week what I'm going to do is I'm going to answer all of those questions as if you called my office, and cover each and every one, so that you will have a comparison when you reach out to other clinics as you go through your due diligence to find the right doctor and right fit for you and your situation. In the meantime, here we are, beginning of 2025. I wish all of you a blessed and wonderful year of healing and happiness, and I look forward to seeing you in the future.